is Jackie. I'm going to be your student nurse today. Can you verify your full name and date of birth for me? Okay, thank you. Do you have any allergies? Okay. Today we're going to be changing your wound dressing and go ahead and clean that up for you. And so it might cause a little bit of discomfort. So your pain that you're having right now on a scale of 1 to 10, with 10 being the most amount of pain and 1 being the least amount of pain, how would you rate your pain right now? Okay. Depending on my patient's response, I would administer pain medication 30 minutes to 60 minutes prior to performing wound care. Okay, I'm going to go ahead and provide some privacy and wash my hands. I'm going to go ahead and gather my supplies. I already have all my supplies here: my solution, my gloves, my tape, pen, the red bag, and the sterile equipment. So I'm going to go ahead and raise the bed to a working height. I'm going to go ahead and lower my side rails. Pull your cheeks back. Okay. Pull off your old dressing. Going to be looking at the old dressing to see, to be looking at the color, the amount, and if there's any odor. There was no odor, the amount was small, and the drainage was serosanguinous. Okay. I'm going to go ahead and assess the wound bed. I'm going to be looking at the color of the wound bed, the skin around it. I'm going to look and see about the wound edges, the wound closure, and if there's presence of drains. Yeah. I'm ready to prepare my sterile fill. I'm going to be checking for making sure the correct solution, looking at the expiration date. So I'm going to pour that, pouring away from the label, making sure I don't splash. farthest from me. Side closest to me. Okay, now I'm ready to measure the wound. Get it moistened. I'm ready to look at the length. The width. And the depth. Okay. Now I have to check for tunneling. There is no tunneling, but if there was, I would mark them using the clock method. Okay, now I'm ready to pack the wound. Not too tight, causing any pain. I'm going to put one more, squeezing out the excess solution. Are you okay? Making sure it's not near the skin. Now I'm ready to apply the dry gauze. I'm ready to remove my sterile glove. lower sides. If there was any hair, I would have to shave it. Staying away as far away from the private area as possible. And I'm going to go ahead and sign, date, and initial the dressing. Okay. Go ahead and lower the bed to the lower position. Put on the side rails. Go ahead and put on some more gloves. Now I'm ready to throw my material away. Okay. Clean the room. Wash my hands again. And I'm ready to go ahead and document in the electronic health record information about the observation and measurements concerning the wound. I would talk about the old dressing as far as like the amount of color, the color of the drainage, the amount of drainage, and if there was an odor. And then I'm going to talk about the fact that the new wound was applied. I will talk about the wound itself before I applied it, as far as the wound closure, the wound edges, in the presence of drains, and the color of the wound bed and the skin. I will talk about the patient's tolerance to the whole procedure.